What blood pressure level can cause a stroke? How high does your blood pressure have to be to trigger a stroke? This isn't just a medical question. It's a life or death issue for millions of people living with high blood pressure every day. Hypertension has long been recognized as the leading risk factor for stroke, a medical emergency that can cause permanent disability or even death if not treated in time. In this video, we'll explore the connection between blood pressure and stroke risk based on the latest research and expert guidelines. You'll learn what blood pressure levels are considered dangerous, the difference between systolic and diastolic pressure, and why even small, prolonged increases can silently damage the blood vessels in your brain. We'll also explain why high blood pressure rarely causes obvious pain or discomfort, yet remains a silent killer that many people don't detect until a stroke has already occurred. Watch to the end of the video. What you learn here could help you avoid a life-altering event. This is your chance to understand the warning signs, know your numbers, and most importantly, learn how to take control of your blood pressure to protect your brain and heart for yourself and the people you love. First things first, let's define what we mean by high blood pressure, or hypertension. Generally, hypertension is diagnosed when your blood pressure reading at a doctor's office is consistently 140/90 millimeters of mercury or higher. If you're measuring at home, the threshold is often considered 135/85 millimeters of mercury or higher. And for those using a 24-hour ambulatory blood pressure monitor, an average of 130/80 millimeters of mercury or higher is typically indicative of hypertension. Now, a common question is whether this threshold changes with age. The answer is generally no. The diagnostic threshold for hypertension itself doesn't usually change. However, individual baseline blood pressures can vary. Some people naturally have slightly higher or lower readings, but significant deviations are usually not the norm without an underlying cause. So, how exactly does high blood pressure lead to a stroke? This is a crucial point. When blood pressure spikes suddenly and severely, it can cause a rupture of blood vessels in the brain. This leads to a hemorrhagic stroke, which is essentially bleeding within the brain. On the other hand, persistently high blood pressure over a long period can damage the small blood vessels, leading to hardening and narrowing, a condition called atherosclerosis. This can eventually block blood flow to a part of the brain, causing an ischemic stroke, also known as a brain infarction. Any blood pressure consistently above the normal 140/90 millimeters of mercury level significantly increases your risk of stroke, and the higher the pressure, the greater the danger. There are these two main types of stroke: hemorrhagic, bleeding, and ischemic, blockage. While ischemic strokes are generally more common, hemorrhagic strokes, though less frequent, often have a higher mortality rate and can present more challenges in treatment. High blood pressure is a leading cause of hemorrhagic stroke because a sudden severe surge of pressure can overwhelm and rupture brain blood vessels. What habits or factors push someone with high blood pressure closer to having a stroke? Several unhealthy habits can exacerbate the risk. A very common and dangerous one is when patients, feeling their blood pressure is stable, decide to stop their medication, change it without medical advice, or continue an old prescription long-term without regular checkups. Some even use medications that are not from a reliable source or try someone else's prescription if they hear it worked well for them, instead of consulting a doctor for a suitable medication tailored to their specific needs. Another damaging misconception is thinking that high blood pressure only affects older adults. This leads many younger individuals to neglect monitoring their blood pressure, delaying necessary checkups and treatment. Recognizing the signs of a stroke is paramount for timely intervention. Whether it's an ischemic or hemorrhagic stroke, the early warning signs are quite similar. There's a simple and effective acronym to remember these: FAST. F stands for face. Look for facial drooping or an uneven smile. A stands for arms. Check if one arm is weak or drifts downward when trying to hold both arms up. S stands for speech. Listen for slurred speech, difficulty speaking, or being unable to understand speech. T stands for time. This is crucial. Time is of the essence. If you see any of these signs, call emergency services immediately. Now, if someone with known high blood pressure shows signs of a stroke, family members might be tempted to give them their usual blood pressure lowering medication. This is not recommended. Lowering blood pressure during an acute stroke needs careful assessment by medical professionals. In a hemorrhagic stroke, rapidly lowering blood pressure can be beneficial to reduce bleeding. However, in an ischemic stroke, lowering blood pressure too much or too quickly can worsen brain damage by further reducing blood flow. Therefore, do not attempt to self-manage blood pressure in a suspected stroke situation. Get the person to an emergency room or a dedicated stroke center as quickly as possible for proper diagnosis and management. What's the correct first aid? If you suspect someone is having a stroke, first and foremost, call for emergency medical help immediately. While waiting for help to arrive, lay the person down, preferably on their side in a recovery position, around a 45-degree angle if possible, to prevent choking if they vomit. Loosen any tight clothing, check their pulse and breathing. If they stop breathing or have no pulse, be prepared to perform CPR if you are trained. Note the time when symptoms first appeared and any other observations about the patient's condition. This information is vital for the medical team. If they are on any medication, try to bring it along to the hospital. We often hear about the golden hour in stroke treatment. Is this different for ischemic versus hemorrhagic strokes? For an ischemic stroke, the golden window for using clot-busting drugs, thrombolytics, is generally within 4.5 hours from the onset of symptoms. For mechanical thrombectomy, a procedure to remove the clot, the window can extend up to 6 hours and sometimes longer in specific cases. For a hemorrhagic stroke, the principle is that the sooner treatment is initiated to control bleeding and pressure, the better the outcome. So, regardless of the type, getting to a medical facility as quickly as possible is absolutely critical. A question that often comes up is why someone might still have a stroke even if they're taking medication for high blood pressure, sometimes even diligently. Stroke occurrence depends on multiple factors: adherence to treatment, suitability of the medication for the individual's age and condition, lifestyle modifications like diet and exercise, and underlying individual predispositions. No treatment can offer a 100% guarantee against stroke, but strict adherence to a comprehensive treatment plan significantly lowers the risk. Conversely, the more risk factors present and the unhealthier the lifestyle, the higher the stroke risk, even with medication. Controlling blood pressure can sometimes be more challenging in certain groups. For example, elderly patients, those with multiple underlying conditions like diabetes, chronic kidney disease, high cholesterol, or other endocrine or heart conditions may find it harder to manage their blood pressure. In older adults, levels of certain hormones like renin and aldosterone tend to be lower, and their ability to excrete salt can be reduced, leading to a diminished response to some blood pressure medications. This makes blood pressure control in the elderly relatively more complex. So, for individuals with high blood pressure, what's the best way to prevent a stroke? Effective blood pressure management, this is primary. Consistent treatment and monitoring are key. Treat comorbidities. Manage other conditions like diabetes and high cholesterol effectively. Healthy lifestyle. This includes a balanced diet, appropriate physical activity, and avoiding harmful habits. Avoid common pitfalls. Do not arbitrarily stop or change medications when you feel fine or your blood pressure seems stable. Do not use old prescriptions indefinitely without regular medical reviews. Let's address some common misconceptions. A big one is, I feel healthy, so even if my blood pressure is high, I don't need treatment. This is dangerous thinking. Another is believing that taking medication is enough without needing to change diet or lifestyle. These are incorrect and can lead to poor blood pressure control and severe complications. Even if you feel no symptoms, high blood pressure needs to be managed to prevent future damage. Regular checkups are crucial to detect any abnormalities early. Especially for younger individuals with hypertension, it's important to investigate potential underlying causes to tailor the most effective treatment. Experts consistently emphasize that high blood pressure is a very significant risk factor for stroke. So if you have a family member with high blood pressure, what should you have on hand and what should you know to help them?
Blood pressure monitor. Having a reliable home blood pressure monitor allows for regular checks, especially when needed. Prescribed medications. Ensure they have their prescribed medications readily available. Know the stroke symptoms fast. Everyone in the household should be familiar with these. Know basic first aid for stroke. Understand how to respond while waiting for emergency services. Being prepared can make a significant difference in a critical situation. We've covered a lot of crucial information today, from understanding blood pressure thresholds to recognizing stroke symptoms and the importance of swift, appropriate action. Remember, high blood pressure is a silent killer, but with knowledge, proactive management, and healthy lifestyle choices, you can significantly reduce your risk of stroke. If you found this information helpful, please give this video a thumbs up, subscribe to the channel for more health insights, and share it with anyone who might benefit. And most importantly, if you have concerns about your blood pressure, please consult with your healthcare provider. They can provide personalized advice and treatment plans. Thank you for watching. Stay healthy, stay informed, and we'll see you in the next video.